Co-locating with SO Trust and Military Surgery is sharing resources and available clinical room for them to be able to accommodate seeing patients or members of the community in order to help and support them finding employment and retain that employment. We have been co-locating with SO Trust since September 2023.
Co-locating supports the delivery of the IPS program as it allows me to engage with the community that I'm here to support. Whilst at the GP practice, I'm able to meet with participants as they walk through the surgery and engage with them casually rather than scheduling appointments. And it allows for the GPs to actually contact me by coming through to the office and having discussions as and when they have a patient in with them. So it's very fluid and it tends to work quite naturally.
There are multiple benefits, both to the patients and to us as a surgery, as an entity. For the patients, it gives them a sense of security, direction in order to find a job and retain the job, how to navigate the different avenues of employment, the correct people to contact, and I think SO Trust is doing a very good job supporting patients with these needs. The benefits then, or the one with the most value, would be that the SO Trust, what they're offering, that service, is another tool for us, which is related to mental health, for us to utilize for the benefit, of our patients and the community at large, rather than signposting to, let's say, secondary care. So it's an extra tool that is very, very valuable in the current scheme of things, if you like.
Another benefit that needs to be mentioned about co-locating is the convenience for patients. That is something that I've heard participants say they're thankful for, allowing them to feel at ease when they approach the employment specialist in the GP practice. It's a safe space for them, and often it's quite nerve-wracking for them to have another person to meet with. So it just allows the process to work a lot more seamlessly and organically. My relationship with the practice manager is, again, something that's quite effortless, to be absolutely honest with you.
Oh, it has been very, very easy actually, because they seem to be very organized from the initial emails all the way to receiving the welcome pack. I had a list of available resources, available contacts, and during the implementation period, anytime I had any questions, I did send an email, and to be honest, it was answered promptly and then within the timely manner. Actually, I was very, very happy about that.
We're really excited about the System 1 being implemented on the IPS program, as it will strengthen the relationship that I already have with the GPs in the practice, as they will be able to check their records and see what the updates are with regards to the patients that they are referring at real time.
As a surgery or as business, if you like, we haven't incurred any costs. That's a free service to us. And we're very, very happy actually that there's no associated costs, no direct ones at least. So we were always active in looking ways to support the community and our patients in things that had to do with, in particular, employment and how to go about it for the ones who were struggling with mental health issues. SO Trust identified a gap, if you like, a need that patients had, and that had to do with how to be able to find and retain employment when they're struggling with particular mental health issues. We didn't have that as a service within our surgery, so it was a great benefit. The impact has been great and has been positive as well. It has been well received by both members of staff and our patients. They're happy that at least within the area of healing, they have a place that they know they can go and speak to an employment specialist, bring forward their concerns and get all the support they need to succeed.
One of the success stories that I would like to share is a participant who had mental or who has mental health issues and who was unemployed for 14 years. He signed up to the program, was quite reluctant initially, and we met with some challenges. However, in the end, through the process and the way in which it works. He was able to secure work with the support and with the guidance, and has now successfully been working and happily employed for the last 5 months.
I would, and I have already recommended the SHO service to our PCN, which is the Primary Care Network, which is a network of different surgeries like us in the community. We have regular meetings, and every time I get a chance, I do advertise this wonderful service from SHO Trust.